Good morning. Welcome to Active Aging with Barb. My name is Barb Eisenberg. I'm a physical therapist assistant and also a licensed massage therapist. I work with a team at Therapy at Home where our passion is to inspire seniors like you to live happier, healthier lives so that you can age successfully and independently with a positive attitude. Together we can create possibilities as we get older and better. So today we are going to be talking for about 5 minutes about fall prevention and balance. I'll even include a few balance exercises. So fall risk, fall prevention, and a few balance exercises. Then we'll spend about 25 minutes with an exercise program to lengthen and strengthen and improve your balance for about 25 minutes. So this information today is for educational purposes only. Remember, if you have any questions about your own health, your own body, make sure you check with your healthcare provider. That being said, why should we be talking about falls and fall risk? 1 in 3 older Americans over the age of 65 have a fall every year in America. It's a terrible statistic. If you think of yourself and 2 other friends, one of you is likely to have a fall. That's how often it happens. Terrible thing, but there's lots of things that we can do about it. Number 2, falls are the leading cause of fatal and non-fatal injuries in older Americans. Another terrible statistic. And worst of all, Wisconsin has the highest number of deaths from falls of any state in the country. Really need to work on that. So falls are not inevitable as we get older. There are lots of things that we can do about it, and we're going to talk about that. There are risk factors that we can look at, and we can address our balance. One of the simplest things to think about is when you walk, if you have a faster gait speed, the faster you walk, the less likely you are to fall. You have to walk safely, of course, but if you have a faster walking pace, that actually lowers your risk of falls. So that's one thing to think about. But we can do an assessment in your own home. You can look at things around in your own home and reduce your risk of falls. So we'll talk about some of those risk factors. And actually, an occupational or a physical therapist that's trained can do an assessment. They can come into your home and they can look around and really help you remove those risk factors and help you make your house as safe as possible. Because falls are more often actually happening in your own home, I believe, than outside of the home. So some of the things in your own home that you can look at: poor eyesight, number 1. Poor lighting. We have to have good lighting to see where we're going. Number 3, clutter. Clutter in hallways, clutter in stairways. It's a very common practice for people to put something on the stairway so you can take it upstairs. Just take it upstairs right away. You'll get a little more exercise, you'll strengthen your legs a little bit, and you'll remove that clutter from the stairs. Keep those stairways and hallways free of clutter. Number 4, medications. Some medications have side effects that actually reduce your balance or impair your balance. So check with your pharmacist or your healthcare provider and see if you have any of those side effects that you have to think about. Maybe there's some other medication that you can try. Number 5, fear factor. Ironically, if you have a fear of falling, that actually makes you more likely to fall. But there are things we can do about it. We can work on our balance and we can improve our balance, improve our confidence. You won't have that fear and you'll actually lower your risk of having a fall. We're going to do a few of those things in a minute. And number 6, distractions or moving too quickly. So if you have a pet, they might distract you while you're walking. If you're having to go to the bathroom in the middle of the night, trying to go too quickly, that can be a factor. And if you're, running to catch the phone or something like that, really increases your risk of falls. So a physical therapist can actually do a risk assessment in your home, but they can also do a balance assessment for you specifically. So looking at your body, they can look at your flexibility, your strength, your balance, use of your senses, and give you a score. There's several different assessments that can be done. And then they can design a specific program for you to address those deficits or those areas that you might be lacking that can improve your balance. So today I'm just going to give you a few exercises in general that you can do. First, you have to have a safe place to do them. I'm going to be using a chair. You can use 2 chairs. You can use 1 chair in front or 1 chair on the side. You can stand at a counter to do the exercises, in a hallway where you have 2 walls, or in a corner where you have 2 walls in case you lose your balance. So make sure you find a safe place. So I'm going to step back and use my chair. A few exercises standing still, and then a few exercises where you're moving, because we're going to stand still and we're also going to move. We always have to have good balance. So first step is just to put your feet together. That's making a narrow base of support that already challenges your balance, and then try to let go of your support. So you might notice that it's a little more difficult. It might be very easy for you to do this. That's the first step. Feet together, narrow base of support. Next step, put one foot ahead of the other foot, still having your feet touching. And then again, try to let go. You can see I'm starting to wiggle a little bit. It's a little more challenging. Then the third step, going a little more difficult, putting one heel touching the toe of the other foot. So like you're standing on a tightrope, and then try to let go. You might have to hold on maybe with 3 fingers, work up to 2 fingers. Eventually you might get to where you can stand and balance heel to toe. This is called tandem stance, and you can see I'm wiggling. That's my balance reflexes. Good job. Next step, highest level, is 1 foot. So you can lift up one heel and see if you can balance there, and gradually try to lift up until you have all the weight on 1 foot and balance that way. That's called single leg stance, the most difficult thing you can do for your balance. Good job. Now we'll do a couple of moving exercises for balance, dynamic balance. Simple thing you can do is just to step to the side. So you can do 10 steps one direction, 10 steps to the other direction. Number 2, backward walking. So gently using those 2 walls, maybe in a hallway is a good place to do it, stepping backwards. 10 steps backwards, turn around, another 10 steps. Really good for your balance. Number 3, probably the most difficult is walking heel to toe, just like the tandem stance, but instead you're actually going to try to move like you're walking on a tightrope. So heel to toe walking, tandem walking, really challenging for your balance. All right, I hope those exercises were useful for you. Remember, there are things you can do. You can have your home assessed for risk factors for falls. You can have your own body and your balance assessed to find out where you're lacking and have a program designed specifically for you. You can contact us at tahcares.com, or go to our website and find our phone number and give us a call. You can set up an appointment. We can do those assessments for you. So remember, there are things you can do. Just to give you an idea, for our next video, we're going to be talking about multiple sclerosis. It's a disease that affects the central nervous system, and it affects your coordination and your balance. Again, we're talking about balance. So remember, there are things you can do to improve your balance and to improve your safety, reduce your risk of falls. We all have to work on that. Before we get started with our exercise program, remember, if you haven't been doing any kind of exercise, make sure you check with your healthcare provider and get an okay from him or her. And if you do have any symptoms once we get moving, chest pains, shortness of breath, dizziness or lightheadedness, make sure you stop and get checked out. Make sure you're okay. All right, let's get moving. We always start with a warm-up. A simple thing to do is to march, or I'm going to get my chair out of the way, just to shift side to side, bending your knees. Anytime you're bending your knees, you're activating these quad muscles, one of the largest muscles in our body. Shifting side to side. And we can reach Just gently reaching one way and the other way. I'm kind of wiping the air. So I'm feeling this in my shoulders, warming up shoulder joints, hip joints. Really want to work as many muscles and joints as possible. Wiping the air and slowly going down. Warming up the hips, warming up the legs. And you always want to take nice deep breaths. Keeping your back flat as you go down. Reaching. And when you get down to the bottom, you can reach to one foot and the other foot. Notice my back is flat. Good job. Then you can round your back and roll up slowly. You should feel a little stretch in your lower back. And reach up to the ceiling. And I'm going to start again. Wiping side to side. Try to go a little farther. We are stretching and strengthening. Wiping the air. Remember, you decide how much you're going to challenge yourself. This may look like a very simple exercise, but if you do it, and if you do it correctly, you're really going to work a lot of muscles. Good work. Wiping the air. All the way down if you can. To one foot and then the other foot. I'm bending my knees. I'm reaching down and reaching up. So I'm even getting a little rotation in my spine. Good work. I'm feeling hips, feeling shoulders, and I'll work my way back up. Reach as far as you can. So by reaching away, we're loading up our core. So we're using our stomach muscles to support our back. Reaching away. Reach and reach. Good work. Now we'll get moving a little more. Let's do some side to side. And kicking. Side and kick. Side and kick. Good work. I'm exercising my facial muscles by smiling. More muscles. All right. Legs are working. Let's get the arms going. Reaching up. Reaching up. Reach and reach. Anytime you're reaching over your head, you're going to increase the level of effort. So if it's too much, just don't reach so high. If you need more work, reach higher. Kicking to the front. Remember, when you're swinging your arms, swing them backwards as well as forwards, so you work both sides of your shoulder. So pull back and lift up. Lift and lift. Lift and lift. Good work. And I'm even trying to notice my feet while I'm doing this. You don't want to neglect any muscle or joint in your body. So I'm trying to press down with my toes as I bring my foot down. Get the feet going as well. Good work. Reaching up. Warming up. As the muscles get warmer, they get more pliable. You'll notice you can stretch farther as you get that blood flowing through them. Really is amazing what our bodies will do if we challenge them and if we make them work. All right, side to side. Side to side, reaching up. Side together, side together. Good work. Reaching up. Now let's reach forward and pull back. Reach and pull, reach and pull. warming up the shoulders and the legs. Good work. We're going for 20 more seconds. Reach and pull. Reach and pull. Always working on posture. Side to side. And we're even working fingers here. Notice I'm lengthening the fingers and then making a tight fist. So warming up the fingers. All right. Now we'll stretch out the shoulder, making a figure 8. So making a circle one direction and then circle the other direction. Bending the knees and circling. Getting bigger, reaching higher and higher. If you've got some stiffness or soreness in your shoulder, just keep it small, but gradually, as you work, cell by cell, you can change your body. Figure 8. Bending those knees, pumping those quads, and let's go the other side. Big circle, circle. Should feel pretty good. Now just because I move my arm doesn't mean that's the only thing I'm working. I'm working the whole shoulder. Shoulder is attached to the spine, through your chest, and through your shoulder blades. Big circle. Circle to the front and behind. Good work. We want to get a little bit more work with the spine. We'll do both arms together. So pulling elbows back and then out and then reaching forward. Trying to put your hands together. Really reach away. When you do this, you should feel a nice stretch in your lower back. So you're pulling your hands in one direction, back in the other direction. Pull and then reach up and open up, trying to open up the chest. Push down. Let's do that again. Reaching forward, pulling in both directions, and then reach up. Open the chest. Good job. And one more time. Reaching forward, pulling in both directions, lifting up, and open up the chest. Really lengthen out. I felt that even in the forearms. Good work. All right, let's move on to hips. So if you need some support with your chair for balance, we're going to do leg lift in the front with the toe pointed. If you want to work your balance, try less pressure on that chair, or try to do without the chair, really challenging your balance. 8, 7, 6, 5, 4, 3, 2, and 1. Now we'll go to the side for 8, 7, 6, 5, 4, 3, 2, 1. When you're going to the side, make sure your knee is pointing to the front, not turned out. So knee toward the front. Let's do other side. Toe is pointed, lifting up. You don't have to lift very high as long as you're activating. Your knee is totally straight. Your quad is activated. Working the hip joint. You're trying not to move your hips, just that, lifting that leg. For 8, 7, 6, 5, 4, 3, 2, and 1. Let's go to the side. So knee is pointing forward, knee is straight, and lifting up. 8, 7, 6, 5, 4, 3, 2, and 1. You might want to have the chair in the front. Now let's do with the toe flexed, and we're going to make a little circle to the back, circle to the front. So a half circle, half circle, half circle, half circle. Good work. So we're working that hip joint in all directions. 2 more. And one more, back and front. Good job. Other foot, heel is down, toe is up. That gives us a little stretch in the back, works the front of your shin. So circle around to the back and circle to the front. Might be a smaller circle, but as long as you're making that motion, you're working front, you're working side, you're working back of the hip. Really great multi-muscle exercise. Front to back, back to front, front to back, back to front. Good work. Trying to maintain our good upright posture. Always working on posture, which strengthens our back, strengthens our shoulders. Let's do 3 more. And 2 more. And 1 more. And back. All right, shake out those hips. You might feel, even though you're moving this leg is really working. That's the whole idea of a single leg stance. When you stand on one foot, this hip has to stabilize, working that hip joint, working those hip muscles, strengthening that hip. So really great exercises if you can stand on one leg to do them. All right, arms. Let's go arms straight out to the side, pushing your heels away from your hand and pushing back, 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 and back. Now go bend the elbows back and then open up. Elbows back. So working your shoulders in 2 ways. Elbows back and straight. Good work. And open up. Back and open. Back and open. Let's go on diagonal. So pulling elbows back and open on a diagonal. And open. Elbows back and open. Elbows back. Good work. Other side. So elbows back on a diagonal. So you're really lengthening your arms. Don't do a wimpy pull. Pull back and really stretch, lengthen. We want long, lengthened muscles as we strengthen them. If you strengthen your muscles in a short way, it tends to pull the joints together. We want to lengthen out to mobilize the joints. Pulling back and back, elbows, straight arms. 2 more and 1 more. Good work. Shake out those shoulders. All right, let's work the back of the hip a little bit. So I'm gonna bend one knee, hold on to my chair and push the hip back, trying to isolate this glute muscle, pushing back for 8, 7. So the knee isn't swinging forward and backward. We're just starting even with the knees and then pushing back. So not a big movement for 8, 7, 6, 5, 4, 3, 2, and 1. Good job. I think I'll move my chair. So hold on to your chair for balance. Bend the knee, pushing back for 8, 7, 6, 5, 4, 3, 2, and 1. So while you're working the back, the glutes, you're also lengthening the front. Muscles are always antagonist and agonist muscles. They're working against each other. So when one is working, the other one usually is stretching. All right, let's do a little plie. So toes are pointed out, wide stance, lower down, and we'll work our quads while we work our arms. So we're going to push to the front, lengthening that shoulder, push to the front, push front, push front, push down, push down, push down. So we're working the side while we're working the legs. And push out, out, push down, push down. Out to the side, pull in, push push up. Let's just do a little lowering down with the knees and reaching up. Lengthening the sides. You should feel a good stretch in your ribs. Pushing up and lowering down. Pushing up. Really working those quads, working the core. Let's do 4 more. Reach. I lost count. Let's do 2 more. And reach down and all the way up. Lengthen those legs and reach and lower down. Shake it out. Hope you felt some work in your quads. All right, let's do some work on our calves. We haven't worked the calves yet, so hold on to your chair for balance and lifting up and up, up, and up. Good job. 1 and 2 and 3 and 4. Now let's go down. So when we bend the knees, bend the ankles, we're getting a little stretch in the Achilles, and then push up to lengthen, and then lift. Lower, bend, up, and lift. Lower, bend for that stretch, up, and lift. Lower, and bend, up, and lift. 1 more. Lower, bend, up, and lift. Good job. If you want a little more challenge, use that chair for balance, and we'll try a few with 1 leg. Lower down, push up, and then lift up that toe, that heel if you can. Lower down, lower, push, push higher, and down. 2 more. Lower and lift, a little higher, and down. Let's try other side. Start with a straight knee, bend the ankle, bend the knee. You're stretching out that Achilles. Push up and then lift and then lower and then down. You're really loading up this quad, loading up the calf. Up and lower and down and up and lower. If it's too much to do with 1 foot, just do the double. Both feet on the ground. Still get a great benefit. Up and down. Good job. All right, let's do a little lunge to the side. So wide stance, point 1 toe out to the side, bend that knee, and we're going to reach out over that knee. So you're loading up the quad. Reach with 1 arm and then reach with the other arm. Try to reach as far as you can. So you're really lengthening from your heel all the way to your fingertips. This means you're working your core. Your abdominal muscles are supporting your back, and you're also loading up this quad. So reaching as far as you can. Long line from your heel all the way to the tip of your fingers. Reach with 1, reach with the other. Good job. Reach and reach. Now both arms out and then lift. Really feeling it in that quad. That's a big load. Let's turn to the other side. So bend that knee and we're going to reach with 1 arm and reach with the other arm. Straight line from my head to my heel. I'm not rounding my back. I'm keeping my chest up. So that's where you get the core working. Reaching with 1 arm and the other arm. If it's too much to reach, you can do it without the arms. So less of a load, but you're still loading up the core. If you keep a nice straight back, chest up, or you could reach not as high. The longer you reach, the bigger the load. It's all about the physics. Reaching and reaching, reaching and reach. Couple more times. 3 and 4. And reach with both arms and then lift, really loading up that quad. Really feel it in that quad. big load when you reach both arms out. All right, what's next? Let's do a little more mobilization of the hip joint, so you can lift your knee and move it in the front and then in the back. So this is just a hip joint rotation to loosen up the hip joint. So knee in front and knee in back, front and back. A lot of people have very tight hips, and tight hips can often lead to lower back pain. So you want to loosen up those hips. Knee in front and knee in behind. Front and behind. Let's do other knee. Knee in front and behind. Just rotating that hip joint, trying to loosen it up. Knee in front and behind. Nice rotation. Loosening up. Should feel good. You just go to your level. Don't try to keep up with anybody else. But inch by inch, if you keep working at it, you're gonna get more mobility. You might reduce any pain that you have in those hip joints. I know this is feeling good on my hips. It's one of my areas of concern. Good work. All right, and now that we loosened it up a little bit, let's stretch it out. So I'd like to put my foot up on the chair. You can also have it on the ground. Toe up, chest up. Turning the toe in and out. A little more loosening of that hip joint. And then come forward for a long hamstring stretch. And breathe. Good work. You can go toe up and down to get a little more calf stretch. And if you turn your toe out and come forward, then you're getting that outer IT band, the outside of your leg. Really important for stability, but if you want a little bit of flexibility so it doesn't cause any knee pain. All right, other side. Heel up, turning it out and in, loosening up that hip joint, and then coming forward, chest up, toe up and down, up and down. Coming forward a little more if you have it. If not, go to your level. But make sure you do a good stretch. And then, if you want to stretch the outside, that IT band, long band of fibers along the outside, you turn your toe out, and then you come forward a little bit. Chest up. If you round your back, you really lose most of the stretch. Good work. All right. And then a calf stretch, reaching your toe back, trying to press your heel into the ground, leg is straight. Straight to start. That stretches the long calf muscle. And breathe. And then sit back for the short calf muscle. And other side, reach back with the toe. Try to press the heel down. Good job. And then shift your weight back to stretch the short calf muscle. Nice work. We're almost done. We'll end with a little balance work. Since we're talking about balance, let's step forward and backward. Forward and back. Forward lift. Forward, backward lift. So I'm just trying to pause, have that chair if your balance needs some work. You might be wiggling. Trying to pause for 1 second, standing on one foot. That's the start. And switch feet, stepping back with the other foot, forward and back, forward and back. Good work. Let's try side to side. Side lift, side lift. Side and lift. Still working on that posture. Shoulders back. Side and lift. Good job. You might start with both hands on the chair. As you're feeling more comfortable, just use one hand on the chair. Inch by inch, you're going to improve your balance, improve your confidence, and reduce your risk of falls. All right. Since we talked about standing on one leg, it strengthens your hip. We'll do this for about 25 seconds. Hips are level. You want to try not to let that other hip drop. This hip is working. Just holding this leg up. So this one, they've actually done research on this. If you stand on one leg 3 times a day for 1 minute, you strengthen their hip and you increase your bone density of your hip joint. So really great exercise, standing on one leg. It's okay to hold on to something. You can feel that hip joint working, those hip muscles. Really great exercise. The hip muscles are really important for balance. One of the primary muscles that you use to balance. Hip joint. Okay, other side. Standing on one foot, holding on to that chair or counter. Nice deep breath. It helps to focus on a spot if you're trying to really improve your balance. You might try to let go. Good work. All right. Deep breath. Nice and tall. And good job. Let's take a couple of breaths to finish out. Release any tension that we gathered up in any of our muscles and joints. And breathe out. One more deep breath in, reaching up and blowing out. Thank you for joining me. This is Activating with Barb. See you next time. Bye-bye.